Hello, I'm Dr. Sandra Freihofer. Welcome to Medicine Matters. The topic, how falling immunization rates could jeopardize the future of COVID vaccination programs. Here's why it matters. Operation Warp Speed. It's a national program to accelerate the development, manufacturing, and distribution of COVID-19 vaccines, and there are many vaccine candidates under study. ACIP, the Advisory Committee on Immunization Practices, has convened a dedicated COVID-19 vaccine work group and is already planning additional meetings. But recent studies have me worried. The World Health Organization reported that as many as 80 million babies worldwide are missing out on routine childhood vaccinations because of COVID-19. At least 68 countries are having problems with their immunization programs, and there are many reasons. People are scared. Many are reluctant to go to a clinic for fear of getting COVID. They're concerned for themselves, for their babies, and for healthcare workers. In some cases, healthcare workers that administer vaccines have been reassigned to respond to the COVID pandemic. Many clinics don't have enough protective equipment and have had to limit the number of patients they see, which means fewer appointments available. Travel restrictions also play a role. Some people may not be physically able to get to a clinic. Travel restrictions, including cutbacks in air travel, can also affect vaccine delivery to the clinic. You can't vaccinate if there's no vaccine available. In some areas, healthcare facilities have had to cancel appointments. Two other studies from the CDC hit closer to home. Even now, during the pandemic, CDC says it's important to prioritize vaccinations of newborns, infants, and young children under the age of 2. But from mid-March to mid-April, doctors in the Vaccine for Children program ordered 2.5 million fewer doses of vaccines and 250,000 fewer doses of measles-containing vaccines, as compared to the same period in 2019. As social distancing rules become more relaxed, children that have not been vaccinated are at even greater risk of getting diseases like measles. Pockets of unvaccinated children led to the surge of measles we saw in 2019, the greatest number of cases reported across the U.S. in more than 20 years. Another recent study shows decline in vaccination rates for children of all ages in Michigan. Vaccination coverage for some diseases dropped below 50%. These drops in immunizations here and around the world are occurring at a time in which we need strong immunization networks and programs. So when a COVID vaccine is available, we have a mechanism in place to get people vaccinated and protected quickly and efficiently. Many experts now predict a second surge of COVID in the fall, right as flu season begins. Everyone 6 months and older needs flu vaccination every year, especially this year. The pandemic presents new challenges. Many routine visits are going virtual, and you cannot give a vaccine over the phone, not even on Zoom. But during these telehealth visits, there's much we can do to promote vaccination. We can reinforce the importance of vaccination and review the vaccinations a patient's needs and come up with a plan. Be creative, be efficient, plan ahead. Administer vaccinations during an in-person visit for another reason. You can give more than one needed vaccination at the same time during the same visit. Consider setting up a drive-through flu vaccination clinic. Physician recommendation is a great motivator for vaccination. 80% of parents say their primary care physicians are trusted sources of information when making vaccination decisions. We need to use that power to strengthen our immunization programs now, before it's too late. So when we have a COVID vaccine, we will be ready. So let's get ready to vaccinate. For Medicine Matters, I'm Dr. Sandra Freihofer.